Hello, everyone. This is Dr. Brody once again. I will suggest that, look, please call all your friends to join us right now. Call all your friends to join us right now so we can have the best time of our lives as we prepare for this MCQE1 exam. Today, I have a very, very important topic I want us to review, okay? And if you see underneath the video, it says how to ace MCQs the right way with MedCognito. So today we're going to learn all the tricks and all the things you need to ace MCQs, because remember the exam next year is going to be MCQs alone. So I can see that the numbers are increasing. What I'll suggest is, please kindly go ahead, invite your friends, send the link to your WhatsApp groups, send the link to your Telegram groups, send the link to your Facebook groups. Get them to join us. We are just here to study. And by the way, tell them to also subscribe to the YouTube channel. Please click subscribe to the YouTube channel. Follow us on Facebook. And follow me, Dr. Bruni, as personally as well on Facebook. Make sure you also join in our private Facebook group. I'm sending the link in the comment section. So look, just invite your friends. We have quite a number of people joining us. Please let me also know where you are joining us from. Let me know where you are joining us from. If you are not in our private Facebook group, please click on the link. It will show on the Facebook page. It will also show on the YouTube comment section. Click on the link and join us right now. Please just get your friends to join us. Today's topic is how to ace the MCQs the right way with MedCognito. Remember that reason why we are focusing on this is because the exam has changed. And when times change, you also have to change, right? So the exam has changed. Now, before this, the exam had both MCQs and CDMs, but now that we're going into 2025, from April, there is no more MCQs. There's no more CDMs. It's only MCQs. Only MCQs. And the total number of MCQs, I think, will be 260, right? 260. And instead of a 9-hour exam, it's now going to be 6.5 hours. So you are going to get 3 hours off. No more CDM, only MCQs. And that is why we are here to share what we are here to share. So please get your friends, get them to join us. Get them to join us as well. Type in the comment section where you are joining us from. Where you are joining us from. And let's get it going. Thank you very much. So look, today's class is how to ace the MCQs the right way with MedCognito. Now, why am I saying that? Look, there's a science to everything. There's a science to everything, an absolute science to everything. Someone is joining us from Mexico. Powerful. MedCognito is going far, and I'm very happy about it. We get someone join us from Mexico. Trace Licks is joining us from Mexico. Well, that's good. Okay, so I always say that there's a principle to everything in life, okay? And especially when it even comes to MCQs as well, there's a principle to them. So today we are going to learn about 9 principles, which will help us to, ace about 80 to 90% of all MCQs we will meet in our exam. So we have another one join us from South Africa. That is Dr. Isaac Lukusa. Okay, good. So what do I mean by that? Number one, if you want to ace MCQs, the first principle, and each principle I'll give a question and you will tell me how you eliminated or how you dealt with that principle. So the first trick I want us to learn is this. You've got to eliminate the absurd and the obvious answers. That's the first thing I want you to know. Eliminate the absurd. This thing can't be right. Why am I even being quizzed on this? So the point is this. When you're approaching MCQs, okay, some answer choices are either clearly wrong or nonsensical based on your medical knowledge and the clinical scenario. So there are some things which are clearly wrong. So if you have 5 MCQs, you need to know how you're going to position yourself. Okay, by identifying and ruling out these options which are clearly wrong, you can focus on the more plausible answers. And why do we use this technique? We use this technique which helps us to streamline our decision making, and it increases the chances of selecting the correct responses even if you're unsure. So I'm going to give you 2 questions. First, you're going to tell me what the absurd answers are, which you're going to rule out. And then you're going to tell me which answers you're going to choose. By the way, like what we did the last time, I will need some friends with me. So if you want to join me, I will send the link and you can join me right now. Please make sure that when you're joining me, because you can help me to read the questions, make sure that you're joining me, your camera is on so that we can have a good interaction, right? The last time it was awesome. And today as well, anyone who wants to join me, we can take a maximum of 8 people. So I've put the link in the comment section. Please click on it, join me, let's study together. Click on it, join me, let's study together. So if you want to join me, just click on the link so you can help me read the question and we can interact live, and others can also follow. Okay, so let's start. So I'm going to give you the question, okay? And then what I need you to do then is tell me the obvious point which is wrong, which is absurd, and then we'll go to the correct answer. So let's start. So today we are going, so don't just choose the correct answer, but choose, let me know what the absurd thing, because we are learning the principles, right? What answer there is absurd as well. I'm waiting for anyone who wants to join me so that we can do this live. Okay, so now this is the first question. Question 1. You have a 45-year-old woman who presents with a history of severe headaches, nausea, and visual changes. Her blood pressure is 190/110, and fundoscopy reveals papilledema. Which of the following is the most likely diagnosis? So first, what I want you to do is type the absurd answers, because that's the principle we are learning here, before you type the correct answer, or before you type the correct alphabet, whether it's A, B, C, or D. So 45-year-old woman presents with a history of severe headaches, nausea, and visual changes. Her blood pressure is 190/110, and fundoscopy reveals papilledema. Which of the following is the most likely diagnosis? A, migraine headache. B, hypertensive emergency. C, common cold. And D, sinusitis. So what I need you to do is this. Look, type the absurd answer. The absurd answer. And why is that answer absurd? I really wish I could have someone who will, join me live, because then we can have an actual conversation about what we are doing. Okay? So type the absurd answer. Which of them is okay? So let's start. So Dr. Yvette says common cold is absurd. Good. Dr. Umua Amazing John says C and D. So that means common cold and sinusitis. I really wish, Okay, Dr. Shinwari is trying to join me. Dr. Shinwari, if you can put on your camera, then we can allow you to join. Okay. So Dr. Anna also says C and D are also absurd. Okay. So it looks like everybody is saying C and D are absurd. So that means what is the correct answer then? Please type your answers. Let me see. What is the correct answer then? If C and D are absurd, what's the correct answer? And if so, why? Okay. So Dr. Thomas says the correct answer is B. I think this one is very obvious. Blood pressure of 190/110. Of course, the answer will be B, hypertensive emergency. right? But remember that we are not just learning the correct answer. We are learning how to select our answers, and we are learning that we've got to eliminate the absurd answer. So hypertensive emergency, common cold, everyone gets common cold. Nobody gets common cold and blood pressure is through the roof and the person has developed papilledema. No. Number two, sinusitis is also absurd because it doesn't present that way with papilledema. Migraine headache can present with hypertension can lead to headaches and all those things. However, migraine headache will not present with papilledema. So the obvious answer here is B, which is hypertensive emergency. That was an easy one. So I want us to go to the second one. Tell me the absurd answer. And I'm going to read a question for you. You have a 25-year-old man who is brought to the emergency department after ingesting a substance at a party. Please remember you are choosing you are typing the absurd answer first. This guy is unresponsive with pinpoint pupils and a respiratory rate of 6 breaths per minute. And what's the most appropriate initial management? A, administer naloxone. B, give broad spectrum antibiotics. C, start an insulin drip. D, perform a lumbar puncture. Which of these answers is absurd? Or which of these answers are absurd? I want to know that. Okay, Dr. Peter has joined me. So please, which of these answers are absurd? I think Dr. Shimwari wants to join, but I can't.
Option B,
Dr.
perform a lumbar puncture.
Sorry, what did you say?
Option B, perform a lumbar puncture.
Sure. Dr. Peter, please, I think your voice is a bit far.
Option B, perform a lumbar puncture.
Option D, perform a lumbar puncture. Why? Why is it absurd? Why is it absurd?
Because it's most likely a drug overdose that we are dealing with, and we will not perform a lumbar puncture. That's not the first option.
Okay, so Dr. Arpita says it's because it looks like a drug overdose, and lumbar puncture is not the first thing you want to do. Okay, now Dr. Shinwari, I have a question. Which of these other we are learning the principles here? Which other answer there will you consider as absurd?
Yeah, the absurd answer like broad spectrum antibiotic B is
Broad spectrum
also
antibiotic. Beautiful.
yeah.
Why? Why is it absurd? Why?
Yeah, maybe like we're treating by broad spectrum antibiotic if someone engaged like the different substances, maybe like poisoning, food poisoning, maybe other thing else, like then we using broad spectrum antibiotic first. But the correct answer is A.
Okay, so the correct answer is A. Now that
Yeah.
brings me to another question. Please, do we all agree that the correct answer is A? Dr. Peter, do you agree that the correct answer is A? Okay, good. So now I have another question. Have you heard about what you call the coma cocktail before? Coma cocktail. Like you have somebody who comes. So the correct answer is A, administer naloxone, right? Remember, we are learning principles on how to answer questions in the MCQ. We know that the correct answer is A. But why are the rest wrong? Dr. Shinwari said giving broad spectrum antibiotics is absurd in the context of an acute unresponsive and respiratory distress. Right. Now, I have a question. What are the components of the coma cocktail? Have you heard about that before? Coma cocktail. Who knows it? If anyone knows it in the comment section, I'll be very glad that you share it. What are the components of the coma cocktail? Who knows it? Dr. Arpita, have you heard about that before? Have you heard about coma cocktail before?
No.
Oh, okay, sure. What about Dr. Shinwari? Have you heard about the coma cocktail before?
No, sorry, I didn't hear about it. It's my first
Okay, sure.
time.
So basically, the question, the coma cocktail is if you have a patient who comes into your emergency room who is unresponsive, what are the first things you want to do? Okay, this is not part of the lesson, but just because we are talking about it and we're talking about absurd answers, Have you heard about the don't acronym before? Don't. DONT. Don't acronym. This is what you call like this is what we use for the coma cocktail, right? Don't, don't. D stands for what? Dr. Peter, can you guess? Someone comes into your emergency room. The person is unresponsive. These are four
Can
things
I tell you? I
what?
know the abbreviation of don't. Yeah, I
Okay.
know how to tell. Yeah,
Okay, so what is D?
like D is for stand for dextrose. We are
Dextrose.
going live.
Exactly. Exactly.
Yeah.
So D is for dextrose. What about
Yeah.
O? So you are
O
dealing
for
with a patient who
O
is unresponsive. Yes? Mhm.
O for oxygen.
Oxygen. Beautiful. Then N is for what?
N is for like antidote. Naloxone.
Naloxone.
Yeah.
Exactly. Exactly. And then T is for what?
T is for like thiamine. Like if the alcoholic patient came in, we know that he is drinking alcohol, so sometime we giving first thiamine, then we giving the other drugs.
Simple. So the don't acronym. So Dr. Arpita, this is it. This is the don't acronym. If you have any comatose patient who is brought to you and you have to work on that patient, these are the first four things you want to do: dextrose, oxygen, naloxone, thiamine, right? Don't.
Yeah.
So that is it. So we are still learning how to avoid choosing, the wrong answers and how to ace the MCQs. Okay, good. So now let's go to the next question or the next principle. The next principle in how to ace the MCQ is you want to aim for the balanced choice. What do I mean by that? When you're confronted with answer options that seem overly extreme, for example, so if you're in an MCQ situation and then you see some answers, you think, this is over the bar, like this is too extreme, okay, or this is not likely. So over the bar of or not likely, such as the highest or lowest value, it's often safer to gravitate towards the more moderate or balanced choice. What do I mean by that? It does not always guarantee that it will help you get the right answer, but today we are learning strategies, right? And this strategy can guide you towards the most reasonable answer when you are uncertain, as the correct response often falls somewhere between the extremes. So let's look at the most reasonable answer. Dr. Peter, please, I need you to read this question for me. Dr. Peter, please read this question for me. Yeah.
A 35-year-old male presents with a fever, cough, and rust-colored sputum. A chest X-ray shows consolidation in the right lower lobe. What is the most likely causative organism?
Okay.
Options are
So um we are going to use the principle of choosing a more balanced answer, right? Not going the extremes. So let me read it again for you, Dr. Peter. It says, a 35-year-old male presents with a fever, cough, and rust-colored sputum. A chest X-ray shows consolidation in the right lower lobe. What's the most likely causative organism? So, Dr. Peter, I'll come back to you. And all the doctors who are listening on Facebook and YouTube, Dr. Peter, which of these answers do you think is extreme? And Dr. Shinwari, you can also come in after Dr. Peter speaks. We are talking about extreme answers, avoiding extreme answers. So I think this question is, if we should put it again, this question is basically asking you, what is the most common causative organism for pneumonia? Because consolidation in the right lower lobe means there's pneumonia in the right lower lobe, right? So if you want to put this question right, it will basically be, what is the most common organism which causes pneumonia? So now the question is this: Staphylococcus aureus, A; B, strep pneumonia; C, Mycobacterium tuberculosis; D, Coxiella burnetii. Which of these organisms is not likely to cause the regular community acquired pneumonia? Dr. Peter, you can speak.
it's Staphylococcus aureus and
So,
Coxiella burnetii. They
Okay,
went to.
so Staphylococcus aureus and Coxiella burnetii. Let me come back to you. Staphylococcus aureus, under what circumstance can Staphylococcus aureus cause a pneumonia-like picture? Under what circumstance? And please, those in the comment section, you can also type. And Dr. Shinwari, you can also let me know if you know, like, which kind of pneumonia or in which group of people can Staphylococcus aureus lead to pneumonia? Let me show you this. So if I show you my hand, and I'm doing this. IV drug users, right? IV drug users. IV drug users, you can get Staphylococcus aureus leading to pneumonia. Okay, what about Coxiella burnetii? Coxiella. Under what circumstance will a patient be exposed to Coxiella burnetii? Coxiella. Coxiella burnetii. Under what circumstance will a patient be exposed to Coxiella burnetii? Coxiella. When will a patient be exposed? Dr. Peter, do you have any idea? Not really. Dr. Shinwari, do you have any idea?
What about Coxiella burnetii?
Yes, like under what circumstance will patients develop pneumonia from Coxiella burnetii?
Like it causing Q fever. We calling it is causing like the Q fever.
Yeah, so what should the patient be exposed to develop pneumonia from Coxiella burnetii?
Like intercellular pathogen, like when pathogen enter like by drop by air respiration, and it may causing.
Good. So he said by respiration. So
Yep.
let me maybe put my question again.
Mali
Okay. By the way, this question, what is the correct answer?
The correct answer for this question there is a streptococcus pneumonia. Streptococcus pneumonia.
Strep pneumonia. Exactly.
Yeah. According to age, like if we
Sure.
say age, yeah.
Don't even make it complex for yourself. Strep pneumonia
Yeah.
is the commonest.
Yeah.
What are other common causes of pneumonia? Do we know? Strep pneumonia,
Mycoplasma pneumonia,
mm,
H influenza
H
sometime.
influenza, yeah, mycoplasma,
Yeah.
Moraxella catarrhalis, right? Okay.
Yeah. Oh my
Now,
God.
now, so let's look at this. Staph aureus is too extreme. So we are learning the principles. We are not just looking at the correct answers. We are learning how we can use the principles to answer our questions, right? So Staph aureus is too extreme unless the patient has a history of IV drug use. IV drug use. So if you're thinking about pneumonia in an IV drug use, the causative organism, think about Staph aureus.
Staphylococcus aureus. Yeah.
Now, what about Mycoplasma tuberculosis? It is less likely because the clinical picture points to an acute
Yeah.
bacterial pneumonia. But we know that Mycoplasma tuberculosis will lead to tuberculosis, right? Pulmonary tuberculosis. Then
Yeah.
Coxiella burnetii, remember I was asking you about that. It is an uncommon cause of pneumonia and would only be relevant in specific settings like, so if I told you, Dr. Peter, if I told you that the person had gone to a farm to visit, then that will help you to know that, okay, maybe Coxiella, or oh, I really like this. Look at this. Dr. Amarachi says veterinarians. So maybe I will not say the person went to a farm, but I can say 50-year-old community veterinary officer. You know, I can, as soon as I say that, that takes you away from Staph aureus, that even takes you away from strep pneumo, that takes you to Coxiella burnetii. So I really like that. So in if you have a patient who comes in as a farmer with pneumonia-like symptoms, somebody who has been exposed to birds with pneumonia-like symptoms, somebody who has been exposed to animal farms with pneumonia-like symptoms, think about Coxiella burnetii. So Dr. Peter, I have a question. Under what circumstance, which clinical picture do you think I can give you which will point you to Mycoplasma pneumoniae? No, Mycobacterium tuberculosis, sorry. Mycobacterium tuberculosis. Which picture can I give you or do you expect me to give you in a question stem, which will point you to Mycobacterium tuberculosis?
Prolonged cough, more than 2 weeks.
Prolonged cough, beautiful. What else?
Night sweats.
What?
Night sweats.
Night sweats. What else?
Productive sputum.
Productive sputum. In terms of exposure, in what clinical setting do you think these patients would have been, which will point to pneumonia?
Crowded places.
Crowded places, for example, what?
For example, hostels, dormitories.
Dormitories, so congested dormitories, right? What about someone who has probably been to like the prison, right?
Yes.
And the person is coming from maybe the third world country, the person has not had immunization. So those are the things you want to watch out for. Okay, let's go to another thing. Another principle which can help us to ace MCQs is to learn to identify the misfits. Okay, when you are analyzing your answer choices, look for patterns or similarities among the options. If 3 options share a common theme or are consistent with the clinical scenario, then the outlier is often the incorrect one. So always look for the outlier. So this strategy helps you to focus on eliminating the odd choice. So I have a question here. Dr. Peter, please read this question for me, please.
A 55-year-old male presents with chest pain radiating to his left arm. His ECG shows ST segment elevation in leads 2, 3, and ABS. Which of the following is the most appropriate initial management?
Good.
Options are
Continue.
aspirin, clopidogrel, morphine, and albuterol.
Okay, good. So I have a question. Even without reading the question stem itself, okay, forget about the question stem. Forget about the question stem. If you have medications like aspirin, clopidogrel, morphine, albuterol, or Ventolin, which of these medications do you think is a misfit? If you were to classify medications and you were given 4 medications, aspirin, clopidogrel, morphine, albuterol, which of them do you think does not fit in the list?
According to me, it will be option B, albuterol.
Albuterol. Why? Now tell me why the rest of the 3 belong in one family, but then albuterol belongs to a different family. Why does albuterol stand out for you?
Because other 3 medications like aspirin, clopidogrel, and morphine, they are used in the treatment of myocardial infarction,
Beautiful.
especially ST segment elevation myocardial infarction.
Beautiful. But then
Whereas
what about albuterol?
albuterol is a bronchodilator used in asthma.
Good. So you see, if you want to learn how to eliminate answers, this is what you do. Okay, I'm confused. Let me even forget about the question stem itself. Assuming the question stem does not exist, okay, I'm going to blacken it out. Assuming the question stem does not exist, and I look at these 4 medications, which of the medications does not belong in the family? And it is albuterol. Okay, Dr. Shenwari. So, like what Dr. Arpita said, aspirin, clopidogrel, and morphine are all standard components of the management of acute myocardial infarction. And so they fit the clinical picture. But albuterol is the odd one out, right? Albuterol is used for cases like asthma or COPD. So
Yeah.
that makes it wrong. Okay, good.
Yeah.
Dr. Shenwari, please take the next question for me. And then you will also eliminate. In fact, if I should cover this question, we
Yeah.
are just learning tricks, right?
Yeah.
If I should
Okay.
cover this
Yeah.
question, I'm covering the question. Spironolactone, metformin, oral contraceptive pills, and furosemide. Which of them is the odd one out? Oh, sorry. I don't know. I think Dr. Shinwari's camera is off. So let me come to Dr. Arpita, and the rest of the group. Spironolactone, metformin, furosemide, oral contraceptive pills. I've covered the question. We are looking at how to answer MCQs. Which of these medications is the odd one out? And you
D.
tell me why.
If you're furosemide.
Furosemide. Okay,
Yeah.
that's a good one, Dr. Shimwari. Why is furosemide the odd one out?
Yeah, this is like diuretic.
Okay, it's a diuretic, but spironolactone is also a potassium sparing diuretic, right?
The remaining drug, like also some of them used for the like spinal lectora, sometimes cangrim, hirsutism, oral contraceptive pills, metformin we use for the like for the weight loss in the obesities, for the diabetes.
Okay,
So we remove furosemide from this.
okay. So I have a question. So, Dr. Peter, I'll
Like
come to you.
like our history is a polycystic ovarian cyst.
Beautiful. So I was going to ask you, which
Yeah.
one condition will you see spironolactone, metformin, and oral contraceptive pills coming together? It
Yeah.
is polycystic ovarian syndrome, PCOS, right? PCOS. It is polycystic ovarian syndrome. So now, you see, even without reading the question, now let me take the highlight off, and then let's look at something here. You see, we do not even have to read the question. So now the question is, a 30-year-old woman with a history of polycystic ovarian syndrome presents with irregular menstrual cycles and excessive hair growth. Which of the following is the most appropriate initial treatment? A, spironolactone. B, metformin. C, oral contraceptive pills. And D, furosemide. So you see, even without reading the question,
Yeah.
you could look at the answers and go I can tie three answers to one condition, but one answer does not belong. Please, you see, today's exercise is not just about, oh, I got it right. Today's exercise is about the principles you can use so that even, you can get the best out of the MCQs. Please, are we all following? Beautiful. Okay. So that is it. I think we've already made our point. Number 4, the fourth trick. Look for keywords and detailed options. The language used in the question and options can reveal important clues. So if you see words like always, never, only, the answer is often incorrect. Since medicine rarely deals with absolutes. So you see, words like always is like an absolute term, never is an absolute term, only is an absolute term. And realize that in medicine, never say never, right? Never say always. Never say, breast cancer is only found in women. No, we have male breast cancer, right? Please, are you following me? In medicine, never say never. So when you see answer options and it's saying always, only, never, run away. So let's look at this question. Dr. Alpita, please read the question for me. Just
A
raise your voice a little bit.
A 28-year-old woman presents with fatigue and pallor. Her hemoglobin is 8.5 grams per deciliter and her peripheral tear shows microcytic hypochromic red cells. What is the most appropriate next step in management? Options are start iron supplements immediately, perform a bone marrow biopsy, obtain serum ferritin and iron studies, and always treat with erythropoietin.
Okay, so 28-year-old woman presents with fatigue and pallor. Her hemoglobin is 8.5 and her peripheral smear shows microcytic
Hypochromic.
hypochromic red cells. What is the most appropriate next step? Now, with the principle we just learned, Dr. Peter, even without reading the rest of the answers, which answer will you throw out? With the principle we learned that don't depend on absolutes.
B.
B. Always treat with erythropoietin. We
Beautiful.
will rule
D,
out the
always treat with erythropoietin. So in reality, with that principle we've learned, we've taken this one out. We've eliminated this one. Good. So now we have 3 more answers to go. So Dr. Peter and Dr. Shinwari and everybody on the call, what then will be your correct answer?
Like it is, according to the history, it is like iron deficiency anemia.
Okay, so what will you do?
Yeah, we can start like iron supplement immediately.
Okay, so that is Dr. Shinwari. Dr. Peter, do you have a different answer? So what answer will you go for?
C. Obtain serum ferritin and iron supplement.
Yeah, that is also.
Beautiful. Now, why is it so? The question then will become, is iron deficiency anemia the only cause of microcytic anemia?
No.
Good. So if iron deficiency anemia is not the only cause of microcytic anemia, but I see that I go like, well, I'm going to start my iron supplementation immediately. That means I am missing other diagnoses as well. So now let me come back. What are the causes of microcytic anemia apart from
Iron
iron deficiency anemia? Apart from iron deficiency anemia, what are other causes of microcytic anemia?
Sickle cell anemia, thalassemia,
Sorry, I didn't hear you.
sickle cell anemia, thalassemia,
You said thalassemia and what?
iron
sickle cell
deficiency anemia, thalassemia, sideroblastic anemia.
Good. And what is the last one? Lead poisoning, right? So
Yeah,
causes microcytic anemia. So even though you've seen that the patient's hemoglobin is 8.5 and the peripheral smear shows microcytic hypochromic red cells, don't just jump into I'm going to give iron supplement immediately because there are other causes of microcytic anemia. Bone marrow biopsy is too far fetched. Like, you just did a hemoglobin of 8.5 and you're going to do bone marrow biopsy? No, right? So at times, when you have other differentials of the same thing, you want to clinch the diagnosis before you start treatment. Therefore, the answer will not be A, but rather be C. Doctors, please, are we all on the same page? I want to make sure. Are we all on the same page?
Yes.
Everyone, beautiful, beautiful, beautiful. So today we are learning the principles. Let's go for another question. So I was teaching that obtain serum ferritin and iron studies. Starting iron supplementation immediately is tempting. So Dr. Shinwari, but it skips confirming the diagnosis of iron deficiency anemia. And microcytic anemia could also be caused by other things, right? So you want to confirm the diagnosis before you start your treatment. And then performing bone marrow biopsy is too invasive, okay? And it is unnecessary at this particular stage. And number D, always treat with erythropoietin. That's the word we want to avoid. Always. No, 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 no. In medicine, there's nothing like always, right? Okay, good. Dr. Shinwari, now you can read this question for us, please.
Yeah. A 45 years old man present with sudden onset chest pain and dyspharosis. An ECG reveal ST segment elevation in lead V1, V4. What is the most likely underlying cause of his condition?
Okay.
Left,
So,
left circumflex artery
mhm.
occlusion, interior wall myocardial infection due to LAD occlusion, never associated with coronary artery disease, pulmonary embolism.
Okay, so with the principle we learned, which answer will you eliminate even before you start looking for the rest of the answers?
C.
C. Beautiful. You see, doctors, there's a principle. I'm very happy we are now getting it. Okay, so even before we go in for any of the answers, boom, we're going to eliminate C. I'm very happy. I'm very, very happy. We're going to eliminate C because we are learning the principle that never say never, never say always, never say yeah, all the time, right? Okay. So now that we've eliminated C, we have three more answers. What answer will you go for? Now that we've
B,
eliminated C, what answer
B,
will you go for?
B, anterior wall myocardial infarction due to LAD occlusion.
What do you say? B.
B, anterior wall MI due to LAD occlusion.
Beautiful. And so I want to give this as an assignment to everybody on this call, whether you're on YouTube, Facebook, whether you're in the MedCognito private WhatsApp group. I want you to tell me, or when we are done with the class, send this message to me in the WhatsApp group or in the Facebook group. V1 to V4, what kind of myocardial infarction is that? And which vessels are affected? Okay, so tell me the ECG location, tell me the vessel, tell me the kind of myocardial infarction. If you have a myocardial infarction lead AVF, lead 2 as well, what kind of myocardial infarction is that? What vessel is affected, right? All those things, the kinds of myocardial infarction, or the name of the myocardial infarction, the vessel affected, and the ECG pattern. Please, when we are done with the class, send this to me privately. Okay. So the next point is that you have to go with your gut. You know, there are times you are learning and you have the gut feeling, right? If you're uncertain about an answer, your first instinct is often correct, particularly if you have a foundational understanding of the topic. And that is why it's also important that in your preparation, whatever material you are using, whatever course you are attending, make sure that you have good background. Avoid second guessing, because you know what? That is what I've seen even in our mock exams. Some people are doing well and then they start going back to change their answers. And then when they start changing their answers, Dr. Arpita, you realize that, oh, Dr. Boni, this was my correct answer and I changed it and I went for something else and oh my goodness, you know, that kind of thing, right? So always be careful. Trust your gut. So trust your initial choice. So let's go. Dr. Shinwari answered this question. So let's do this one for Dr. Arpita. Dr. Arpita, take this question for me and let me see what your gut's feeling will tell you.
A 60-year-old man presents with a sudden onset of excruciating abdominal pain radiating to his back. He has a history of hypertension and smoking. His blood pressure is 90 over 60 millimeters of mercury and his heart rate is 120 beats per minute. What is the most likely diagnosis?
Continue.
Options are acute pancreatitis, ruptured abdominal aortic aneurysm, myocardial infarction, intestinal obstruction.
Okay, good. So what does your gut feeling tell you, Dr. Arpita? Your gut feeling. This presentation, it's talking about this particular thing. What does your gut feeling tell you?
I'm confused between two options, but I'm more inclined towards B, ruptured abdominal aortic aneurysm, because the blood pressure is low, heart rate is more. So, might be due to the ruptured aneurysm, the patient is going into shock.
Beautiful. Dr. Shinwari, do you have a different gut feeling than what Dr. Arpita had? Sorry, you're muted.
I'm going to the answer B same, but it is like the history is different, like not for acute pancreatitis. For acute pancreatitis, like we use I get smashed word.
Okay, yeah.
So yeah.
But then here, I think what gives it away is the blood pressure, right?
Yeah, history of hypertension is smoking, yeah.
The
So
blood
history of hypertension, not like myocardial infarction, it is not myocardial infarction.
Exactly.
Not intestinal obstruction, because intestinal may be like vomiting. Release
Exactly.
vomiting, yeah.
Exactly.
Not acute pancreatitis, we not go for. So the B answer B is correct. Rupture abdominal.
So since you
Or
talked about I get smashed, what are the components of I get smashed? Just talk me
yeah,
through.
I'm I for idiopathic, G for gallstone, E for ethanol, T for trauma, S for smallpox, M for measles, T for trauma, yeah,
Good.
and D for drugs.
So I get smashed, but then this question is giving us risk factors for abdominal aortic aneurysm, hypertension,
Yeah,
smoking, older age gentleman, blood pressure is low, right?
yeah,
So
yeah,
it is likely triple A, ruptured triple A. The
yeah,
gut instinct might immediately associate keywords, excruciating,
yeah,
abdominal pain, hypotension, risk
yeah,
factors, smoking, hypertension, that kind of thing. Okay,
yeah.
good. Next question. Now, this one comes from This one comes to Dr. Shinwari. This question comes to you. So read the question for us, please. Read it out loud.
Yeah, a 25 years old woman present with fever, lung pain, and dysuria.
Mhm.
His urine analysis shown significant leukocytes and nitrates. What is the most likely diagnosis?
Okay.
Yeah, acute cystitis, pyelonephritis, nephrolithiasis, pelvic inflammatory disease.
Okay. Gut feeling. What does your gut feeling say?
Yeah. If I say
Your
like
gut-
this is the fever, lung pain, and dysuria, so this is like the symptom of this in flank pain. So I will go to the pyelonephritis.
Simple. Gut feeling. Flank pain goes with pyelonephritis. You know,
Yeah,
this one, no need to stress about it. Gut feeling.
yeah,
Your gut
yeah,
feeling, because you've read this over and over and over again. You know, acute cystitis is tempting, but fever and flank pain. We see so many people with cystitis and they don't have fever and flank pain, right?
yeah,
Nephrolithiasis is less likely because it doesn't typically cause nitrites on urinalysis, right? If there's
mhm,
nitrite, that tells you that there's a bacterial infection. Nephrolithiasis will usually present with only blood, right?
yeah,
Only blood.
mm,
Yeah.
yeah,
You know, PID would not fit dysuria and nitrite, but rather it will have a lot of pelvic symptoms. So your natural instinct will go with pyelonephritis. Now,
mm,
let's look at the next principle. Use the process of elimination. Elimination. When you are unsure of the correct answer, systematically rule out options you know are incorrect. By narrowing down your choices, you improve the odds. Okay, so now let me go to Dr. Peter. Dr. Peter, you have a 40-year-old man who presents with fever, fatigue, weight loss, and persistent diarrhea. Examination reveals a skin rash with papules and vesicles over the elbows and the knees. A biopsy of the rash confirms dermatitis herpetiformis. What's the most likely diagnosis? What's the most likely diagnosis? Dr. Peter, what's the most likely diagnosis? What condition is usually related with dermatitis herpetiformis? It looks like all these are GI conditions: irritable bowel syndrome, Crohn's disease, celiac disease, and ulcerative colitis, right? But which of them is uniquely positioned with dermatitis?
Celiac,
What?
not sure.
What do you say? You're not sure.
Celiac, celiac disease.
Celiac disease. Okay.
Sorry.
Dr. Shinwari, you are shaking your head.
no, I will go for the B. Crohn disease,
Crohn's
dermatitis
disease.
herpetiformis. Yeah, it may causing. Yeah,
Okay. Dr. Arpita, will you still stick with celiac or you change your mind?
No, I was not sure, so I would go with Crohn's now.
You go with Crohn's. Okay. Now, which of these conditions actually presented dermatitis herpetiformis? Is it celiac or Crohn's? Is it celiac or Crohn's?
Celiac.
Is it celiac or Crohn's?
like when we eliminating then the celiac disease, but the correct answer is like Crohn disease.
So, what answer will we go for? Celiac or Crohn's?
Celiac disease.
Celiac. So, so if we should take our time and can you cross check which of the conditions presents with dermatitis herpetiformis? Is it celiac disease or Crohn's disease? Just check. Exactly. So you know what? As I said, Crohn's disease can cause some skin issues, but the condition which is associated with dermatitis herpetiformis is celiac, right? So, Dr. Arpita, when I confused you, you changed your mind and you went for Crohn's. But then Crohn's is not directly related with dermatitis herpetiformis. It's rather celiac disease. Okay. Good. Okay. Now I'll come back to Dr. Shinwari. Dr. Shinwari, read this case for me.
A 55 years old man present with fatigue, pallor, and jaundice. His lab results reveal hemoglobin of 8 gram per deciliter, elevated indirect bilirubin, and reticulocytosis. A direct cum test is positive. What is the most likely cause of the anemia?
Mm-hmm.
Iron deficiency anemia, anemia of chronic disease, autoimmunohemolytic anemia, thalassemia manner.
Okay, good. What is the correct answer? A, B, C, or D? Is it A,
D.
C, or D? What? You go for D.
Yeah.
Dr. Arpita, will you go for something different? Dr. Fia, your boy is going for C.
It's C,
No.
autoimmune hemolytic anemia.
Cum test is positive. Yeah.
What do you say?
C, autoimmune hemolytic anemia.
Autoimmune hemolytic anemia. Dr. Samanthi is also going for C. Dr. Isaac Lukusa is also going for C. Dr. Arpita is going for C. Dr. Shinwari is going for D. And the correct answer is C, autoimmune hemolytic anemia. Okay, so iron deficiency anemia is ruled out because it does not cause jaundice, right? Because the question was talking about jaundice. And of course, anemia of chronic disease can also be eliminated as it typically presents with normocytic or microcytic anemia, but not jaundice or positive Coombs test, right? Now, thalassemia is unlikely because it doesn't usually result in thalassemia minor, sorry. Thalassemia major will result in a lot of hemolysis, but thalassemia minor usually does not cause hemolysis, jaundice, or a positive Coombs test. So the obvious answer then will be autoimmune hemolytic anemia. Okay, good. Now, the next principle I want us to learn here is to follow the common theme. You know, when you are unsure, you want to pay attention to the recurrent patterns of frequently emphasized concepts in your study materials, right? That's why at MedCognito, we also deal with med bullets because we want you to learn concepts over and over and over again. So if one option aligns with what you consistently encountered, it might be the correct answer. So remember that, Dr. Arpita, I think you are in MedCognito, right? And we are always like med bullets, med bullets, med bullets, med bullets, right? Med bullets. Like we're always trying to make sure that you get that concept right. Okay, so let's go through this question. Can you read this question for me, please?
A 30-year-old man presents with fever, malaise, and a productive cough with rust-colored sputum. Chest X-ray shows lobar consolidation. Based on your studies, what is the most likely causative organism? Klebsiella pneumoniae, Streptococcus pneumoniae, Mycoplasma pneumoniae, or Pseudomonas aeruginosa?
Good. What's the correct answer?
Streptococcus pneumoniae.
Strep pneumonia. Okay, I think we've already gone through this when we're dealing with the first question, right? So I'm not going to waste your time on that. Let's go to the next question. You can read it again. I think Dr. Shinwari dropped off.
A 65-year-old man presents with sudden onset, slurred speech, facial drop, facial droop, and weakness in his right arm. CT shows no hemorrhage. Which of the following is the most appropriate immediate intervention? Start aspirin and monitor, administer alteplase, perform carotid end arterectomy, and prescribe physical.
Okay. So 65-year-old man presents with sudden onset, slurred speech, facial droop, and weakness in his right arm. CT shows no hemorrhage. Which of the following is the most appropriate immediate intervention? A. Start aspirin and monitor. B. Administer altiplase. C. perform carotid endarterectomy, D, prescribe physical therapy. What answer will you go for? You've done a
A,
CT.
start
The person
aspirin
has symptoms which look like stroke, and the CT says there is no bleeding. So what will you do?
start aspirin and monitor. Okay.
Start aspirin and monitor. That's your answer. But Dr. Aaron Smith is going for B. Dr. Efia Yeboah is also going for B. Dr. Edward is also going for B. Will you want to change your answer, Dr. Shinwari? Do you have a different answer?
If there is no bleeding, then I will also go for start aspirin and monitor. Yeah.
Start aspirin and monitor. So,
Yeah.
what are you thinking about? Why are you going for aspirin and monitoring? Why?
I think first we have to give the antiplatelet before starting the thrombolytics. That that's why I chose option A.
Okay, so you think you have to give your antiplatelet first before you give your thrombolytic. Is that compulsory? So the answer is administer your altiplase, right? But why is aspirin and monitor dangerous? It might seem reasonable, like what Dr. Peter is saying, but it delays critical thrombolysis. Remember that a contraindication for thrombolysis is what? Intracerebral bleed. The CT scan says that there is no bleed. So what are you waiting for? This patient has a stroke, obviously. Give your altiplase. Because don't forget that there are two types of stroke, hemorrhagic and thrombotic, right? Yes. So it could be that the patient just has thrombotic stroke. The fact that the patient did not bleed means that there's no contraindication to blood thinners, right? Or the altiplase, blood busters. So you can give that. Okay, good. Number 9, recognize answer patterns. Okay, pay attention to potential patterns in the exam's answer choices. If you notice recurrent sequences or trends, this might help you. I think we've already gone through that. But I have this question, Dr. Peter. Please read this question for us.
A 50-year-old woman presents with fatigue and jaundice. Her lab results show elevated ALT, AST, and bilirubin with positive anti-smooth muscle antibodies. What is the most likely diagnosis?
Mhm.
Viral hepatitis, autoimmune hepatitis, alcoholic liver disease, and gallstone obstruction.
Okay, what answer will you go for? What patterns are you seeing?
Uh, autoimmune hepatitis, B.
Autoimmune hepatitis. So, fatigue, jaundice, elevated ALT, AST, bilirubin, positive anti-smooth muscle antibodies. What's the most likely diagnosis? And what is your answer?
Autoimmune hepatitis, B.
Autoimmune hepatitis. Okay. Dr. Shinwari, do you have a different answer? No? Sorry, you're muted. I can't hear you.
Hmm. I will go for the B, autoimmune hepatitis, because it is smooth muscle antibody.
Autoimmune hepatitis. Okay, so we are looking for patterns, right? We are looking for patterns, and the pattern here is autoimmune hepatitis. So, why is autoimmune hepatitis correct? It is correct because the choice fits the clinical picture, right?
Yeah.
So, there is positive
It is smooth
anti-smooth
muscle
muscle
antibody.
antibody, AST is elevated, ALT is elevated, jaundice, fatigue, bilirubin is also elevated. Okay, good. Last question. Dr. Shinwari, you can take this for us. We are looking at recognizing patterns. Mhm. Read the case for us, Dr. Shinwari, please.
Uh, a 35 years old man present with chest pain. It worsen when lying flat and improve when sitting up.
Mhm.
On auscultation, you hear a fraction rub. What is the most likely diagnosis?
Chest
Acute,
pain,
yeah, acute
Western spin.
pericarditis.
Mhm.
Yeah, acute pericarditis, myocardial infarction, gastroesophageal reflex disease, aortic dissection.
Okay. So, what is the correct answer?
The correct answer is A, acute pericarditis.
Acute pericarditis. because of the friction rub, you know. So acute pericarditis is correct based on the positional pain and the friction rub, right?
Yeah.
Myocardial infarction is incorrect because chest pain described as positional and not classic for MI. MI chest pain is not positional, right? GERD can cause chest pain, but not associated with friction rub. So you realize that this one, you're looking for one condition where the patient will present with chest pain and also have the friction rub. And in as much as myocardial infarction will present with chest pain, it will not present with friction rub. GERD can present with chest pain, but there's no friction rub. Aortic dissection will present with tearing chest pain, which radiates to the back, but not friction rub. So the one answer which ties chest pain with friction rub will then be acute pericarditis. Doctors, so I want to know, Dr. Peter, what principle of eliminating answers and acing MCQs did you learn today? And Dr. Shinwari as well. And the rest of the doctors, please, if you can remind me, what did you learn? Dr. Arpita, what one principle did you learn today?
Starting from eliminating the most absurd answers and most unlikely answers.
Beautiful. Eliminate the most absurd and the most unlikely. What else?
Also go with your gut feeling.
Go with your gut feeling. Okay.
See the pattern
Look
of
for the
the
patterns.
look for the pattern, like most unlikely option out of the four we can eliminate.
Beautiful. Beautiful. And do you remember that also try to avoid absolutes, right? And what are some of the absolutes?
Always, never, only.
Only, always, never. I like what Dr. Amazi John said. Never say never. Never say only. Never say always, right? Beautiful. So look, doctors, this is what we are here for. 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 Text me, text me, text me on WhatsApp +1 306 891 5649 +1 306 891 5649. Dr. Shinwari, sorry, what else did you also learn today? Your principles of, you know, answering MCQs. Hello, Dr. Shinwari. Sorry, you're muted.
Your voice is not coming clearly, but today we learn always, never, absolute.
Yeah,
The everything like I was in my mind, we like I think we covered today. That was the
good,
great thing, I thought, yeah.
good, good. So, doctors, text me, text me, text me. Remember, exam is coming in April, May. Text me now. Let's find a way to go around and, ace the exam. Okay. And for those who want to also register for the MedCognito course, remember this is the time to jump in because come January, things are going to change, right? Pricing will be changing. So you can even come in for just 1 month, or you can come in for 6 months and you will still get access to everything we offer. So I'm just going to put the link in the comment section. It's great we learned today. Thanks for seeing you, Dr. Shinwari. I'm very happy to see Dr. Peter as well. I'm putting the link in the comment section. Dr. Peter, you've been with us. What have you been learning so far? Can you share some for me to hear?
Yes, I've gone through the videos on the portal that have been
Okay,
uploaded, and then after I go through the videos and I attend the classes, weekly classes that are being held on Mondays and Thursdays, I feel that it is a very good revision of what I have learned, and the concepts become very clear once the teacher explains
beautiful,
and discusses the questions.
beautiful, beautiful. And remember that I'm also planning on starting something as a top up, right, in January, where we will pick systems and go through them. So, you know what, doctors, we will do our best for you. We will do our best for you and make sure that we all get to the finish line. What I need you to do is to commit yourself, plug into the system, let's study and get it going. Dr. Peter is doing so well. I really, really like the way she went for her answers. Dr. Shinwari as well. Very proud of you for the way you joined me today. So last time we had two people. This time we have two people. I'm hoping that the next time, last time we had three people, and this time we had two. I'm hoping that the next time all five of you will join me so I don't feel lonely on the platform, right? But thank you very much. Someone just sent me a message. Let me read it to you. It says something. I thoroughly enjoyed the class. Quite unusual class, but awesome. Okay. So yes, doctors, that's what we are here for. If you want to reach out, that is my number, +1 306 891 5649. I'll prefer that you contact me by WhatsApp so that people from all over the world can join us today. Some people were joining us from Mexico and all those things. Okay, so please enjoy your evening. Those in MedCognito, remember tomorrow you have a class. What do you say, Dr. Peter?
Thank you so much for the class. It was a wonderful class.
Sure. Dr.
Thank
Shimwari,
you so
thank
much.
you, Dr. Peter. Always. Please, this is my phone number. Reach out to me right away. Let's study together. Let's ace the exam. God bless you. Good night. Bye-bye. Bye-bye.
Thank you so much for joining.
Okay. Bye-bye.
Have a great time.
Bye.